and get started. And I want to thank everybody for being here today and for listening to this program, because I think this is a three-part series. This is webinar number 1 of 3. We are recording everything, so if you were to happen to miss one, you will get the replays of all of them. My name is Valerie Van Boeven. I'm a registered nurse and the co-owner of LTC Expert Publications. Lots of you know us as LTC or LTCEP. We do home care marketing, and we do mostly websites, SEO, and content for all of our clients. And we've known Gary for a very long time. He is the creator of the AlzBetter program. And so we are pleased, very pleased to present this to you today so that you all can learn more about differentiating yourself in the market. We believe his program is good, and we know that Gary has spent about 4 years perfecting it, so it's really worth your listen, and it's really worth considering, because this is a great revenue generator. So with that being said, welcome Gary Skole. I'm glad to have you on today.
Hi, it's great to be here.
Good. Let's go ahead and get right into it then. Gary, tell us a little bit about your background and how you came up with this concept.
Okay. Well, I've been in the home care business since 1989. In July, it'll be my 25th year of being in business. And
Wow.
During that time, I've kind of run the whole gamut. I started with a registry model back in '89, and back in those days, there was probably only 6 other agencies or so in my direct area. Today, I think there's anywhere from 80 to 100, so I think that's pretty typical of many of the markets in this country. And so I started as a registry. We then switched over and opened a payroll W-2 style agency. We became accredited through CHAP. We became Medicaid approved. So I've really seen a number of different styles and just been through it all and done everything in the agency market. You know, really during that time, our agency grew, but it just grew really at an average rate, not really where we wanted it to be. I wouldn't say we were stagnant, but the growth wasn't dynamic by any means. So yeah. I was editing videos about 4 years ago. I think you asked me how we got to this concept, and I was editing videos about 4 years ago, putting continuing education program together for our caregivers, and I happened to be editing on Alzheimer's. And as I watched the videos, I realized that I really didn't have a clue and had no idea how complex Alzheimer's care really was. And I am probably like most agency owners. You know, we would get a call that would come in, and my mom has Alzheimer's, can you handle it? And I'd say, oh, sure, you know, we can do that. And trying to sound like I knew what I was talking about, I'd ask them what I thought intelligent questions. Oh, is your mother agitated? Does she wander? And that was really the extent of my knowledge and what I would ask. And otherwise, we would pretty much treat it like we would every other case. You know, we try and find a caregiver, maybe had some Alzheimer's experience, but our intake was the same, our assessment was the same, and if it was an easy case, it went well, but if it was a challenging case, it usually didn't go so well. So that was really how I started, and this program really evolved because I realized I didn't know, and it just came about from there.
Well, and it's a great realization, and I think a lot of folks out there do realize that, you know, of course they're not going to say no to these cases, but we all know in the back of our minds there's probably, we wish we had a better solution and a better way to handle some of these, especially the more difficult ones. And you know, with this, that's why I'm so glad the AlzBetter program was put together, because this is really great. And I've talked about a little bit about differentiation when I opened up the webinar, and we do preach that you have to differentiate yourself. Stop using platitudes, which mean you say the same thing about you that everybody else says about themselves. You gotta have a way to make yourself stand out from the crowd. So we've been preaching that for a long time. So I'm trying to. So what did you all do to different? This is what differentiates you now, I guess.
Oh, absolutely. You know, I think we were just like all the other agencies, or most of the other agencies that were out there, and had a hard time getting my foot in the door to see the social workers or the care managers or the discharge planners. Couldn't get past the gatekeeper, or if I got past the gatekeeper, I really felt like I was bothering the people. They're all so busy, and I understand how busy they are. And I would go in, and really, I didn't have anything to say that everybody else wasn't saying. There was really nothing, and I just felt like I was bothering them. And, as I was doing a little research for this presentation today, I went online, and I just started looking at other companies' websites. And, when you mentioned platitudes, the first one was your trusted quality in-home senior care provider. And, first of all, if they don't think they're trusted and they're not providing quality care, they shouldn't be in business. But, there's really nothing unique that anybody isn't saying that. We care like it's our own family. Again, I think that's probably the most common line in home care, is everybody that works for me, I would send to my mother. If I didn't feel comfortable sending them to my mother, I wouldn't send them out. I think everybody says that.
I think free in-home consultation probably tops the charts. I can't tell you how many times I've written that down for somebody.
Yeah,
but, you're right.
It's true. I mean, everybody's basically saying the same thing, and you just can't do that when there's 80 or 100 people. And the social workers that I've gotten to know over the years tell me they're tired of these new agencies coming to them. They have their agencies. They don't really need any more, and they just don't want to hear it. So if you don't have a reason to be there, they unfortunately don't want to see you.
That's true. I mean, we really, being in the content management business on the marketing side of this online, these phrases that you have up here are ones I've probably typed about 2 million times in 4 years. So I understand. I totally agree with you. So tell us more about being creative.
So, from our end, we went with a disease-specific program. I'm not going to tell everybody that they have to go that route. That's what we chose, and I'm going to give you a reason why we chose that and why I still think that's the best way to go. But you can be creative in other ways. I, again, looked up what some of the other agencies are doing, and, one of them had you can meet your caregivers before they start. And I thought, well, that's kind of original. Another one had a healthy longevity program, which I thought sounded neat. Get a free tablet computer, which we're actually doing with our dementia clients now. An arrival assurance guarantee, which sounds great. So, there are ways that you can be creative, things that you can do, but the goal is really you've got to be different. You've got to have a reason to go there and a reason to stand out that says you're different from everybody else.
So you have a very interesting theory about why it's important to specialize. Tell us more about that.
Sure. Well, most of the people on this call, I'm assuming, and in this industry, consider themselves to be non-medical. And that pretty much means they're not providing skilled care. And that may be all well and good, and I know a lot of the franchises are selling non-medical models. But in reality, we're really all in the healthcare field. I've taken tons of intakes over the years, and so many times somebody will call and say, I need a nurse for my mom. And they don't really mean a nurse. They're looking for a home health aide or maybe a companion. But in their mind, it's a nurse. It's medically oriented. And if you think of who we're getting our referrals from, we're getting referrals from hospitals, from social workers in hospitals and subacute rehab centers and doctors' offices. And again, people that are in that medical model. So if you look back over the last 50 or even 30 years, my father was a primary care physician. And back then, primary care physicians delivered babies, performed surgery, and generally these days they're not doing that. I mean, maybe in some of the smaller towns they still may be, but in my area, you don't. You go, you can still stay on that other slide.
I'm like, I think I need to change slides. No, I don't.
So yeah, the medical community is specializing. The slide that I have up here is a children's hospital. And you look at this slide, and it's beautiful. It's colorful. It's got zebras. It's got butterflies. It looks fun. And if I'm going to take my child for surgery, do I want a stale old hospital, or do I want to take them somewhere that looks like this and only assuming inside matches that? So when your child is sick, you take them to a pediatrician and to a pediatric hospital. If you're going to have heart surgery, you're going to go to a cardiologist. If you're going to have knee surgery, not only are you going to go to an orthopedic surgeon, but probably one that specializes in knees. So the specialists are specializing. And it goes even further. Let's say you had, God forbid, cancer. And if it was bladder cancer, you would look for a doctor that does bladder cancer. But let's say you have something like a sarcoma in your bladder. Well, you're going to look for a doctor that understands sarcomas. So you're going to really go from a specialist to a really specialist. And
specialist. Yep.
Absolutely. So the people in the community out there, they're looking for that. They're considering us to be part of that community. But the home care industry is sort of in the Stone Age. We're all still just providing general care. And so when you come out with a program that does specialize, such as Alzheimer's, and somebody has a parent with Alzheimer's, well, their mentality is we're looking for a specialist. So that's why I think that this is really working so well.
Oh, you know what? I absolutely believe that. I think that if I'm looking for the best care for my parent who has dementia, and I stumble across this, or hopefully just it's presented to me by a discharge planner or whatever, there would be no doubt. I mean, I would want someone who had folks who are trained in this. So give us some examples of what has worked for you so far.
Sure. So as I was saying, yeah, we were plodding along. We were growing, slightly every year, working really, really hard, but growing. And then over the last few years, as we implemented this program, and our growth wasn't as dramatic because we started out with one piece and added another, and it didn't just start out as a program. It really has been an evolution. But last year, we have one office here in New Jersey. We are 100% private pay, so that's all we're doing. And we grew by almost $1 million last year just out of our one office. So, it really has taken hold. We've become known for this in our area, and it's really just working exceptionally well, and our office is just growing because of that. I can give you another example, too. There's you can go to that next slide. There's a social worker that I've been calling on. Again, I've been in the industry for a long time, for about 20 years, and she was with a medical daycare center. And I would go and call on her, and I really never got anything out of her, literally nothing. Then about 10 years ago, she switched jobs, and she went to a dementia program as part of a medical college. And I thought, oh, this is great. She's seeing people every day with dementia that are coming to her for counseling, and she's part of a medical team with doctors and everybody that specializes in this. So I went back there, and at that time we didn't have an Alzheimer's program. And she greeted me with a hug, and she, oh, how are you? How's the family? Loves me. Still nothing. Didn't get a single referral from her for several more years. And I think that's often very typical. People go in and they think that they're on such great terms, but they just don't get anything out of the referral sources. Then I went back to her once we started our dementia program, and she seemed pretty interested in it. She actually started to give me some pointers and read through our manual and gave me some corrections and started helping me out. And today she's one of our biggest referral sources. So for almost 20 years, I've gotten nothing out of her. And for the last 4 years, she's just a huge referral source for us. And she's introduced me to all the doctors in the facility. In fact, the medical home model of care is becoming a very popular thing with Obamacare. And that's where a physician sort of leads the team and finds all these specialty pieces to plug into it. And we've spoken to them as a medical college of being their dementia part of that program for home care. So it's just worked really, really well. And she's referred us some absolutely huge cases that I'll talk about in a little bit.
Wow, that is really great. That's a great story. I mean, I think we all know folks that we've, and everybody in your local area, I've noticed over the years, we all kind of circulate in the same, we'll move from one place to another, but we're all kind of in that same little big, small world. And it's really interesting that you got that. And I think it's wonderful that she, took the time to introduce you to everyone and is so invested personally in what you guys are doing. That's totally awesome. All right, so this is kind of a trick question or a trick statement here. So you suggest that everyone start a specialty program. We've talked about that, and that sounds pretty easy. So what do you have to say about becoming an expert?
Well, this is a big thing. There's a lot of people that attend a seminar, maybe a weekend seminar or a one-day seminar, or they may purchase a series of videos. And there's some wonderful videos that are out there, although the problem with most of those is they're not home care specific, which is one of the problems that I had with them. but they attend these seminars or maybe a webinar or whatever it's going to be, and suddenly, they're dementia experts, and suddenly they feel that they can do this. And unfortunately, it's not quite that easy. This is a really, really complex disease, and it takes a lot more than that. One of the things that I think about is that if I didn't really know how to do dementia well, and I went out and published myself a brochure and held myself out as a dementia expert, this social worker that I talked about referred a case to us, which is just a huge case. It's a husband and wife that both have dementia. And we have a live-in for the husband, and we have around-the-clock shifts for the wife. So, and again, I'll get into this a little bit more, but the daughter sees this social worker every single month for counseling. Now, when she goes to this social worker, there's two things that really could be happening. Either A, we're doing a great job, which luckily we are, and she goes to the social worker and says, thank you for referring this agency. They're wonderful. They're doing this. They're taking great care of my mom. I don't know how I could survive without them. I couldn't pay a marketing person enough to do what this woman is doing for us. So it's wonderful. It's free. It's genuine. And it's just truly powerful. However, if we screwed up, if this was 5 years ago and I didn't have our program in place and I really didn't know anything about dementia and I would have gotten this case, she would have been going back to that social worker saying, send me a new agency, or I have to put my mother into a nursing home. This place is terrible. How could you send them to me? And it could have been a total disaster. So in my opinion, yes, I think everybody should have a specialty program. But I don't think you can take it lightly. I think you have to really be committed to doing this and to do it right. You wouldn't want to go to an oral or a heart surgeon who's taking a weekend course and say, okay, open me up and let's get to it. It doesn't work that way, and in some ways dementia can be even more complicated. It can be a very tough disease. So I think that you really have to be committed to doing this.
Absolutely, and so it sounds like you really need to be committed to doing this. So why is it worth the extra effort?
Okay, well, it is a huge challenge, but the statistics are overwhelming. And, everybody knows that the baby boomers are getting older, and a reason that many of the people that got into this industry got into it because they know that this market is just huge. And I've read statistics that people that are 85 and over, 50% have dementia. I don't know if it's quite that high, but it's a very high percentage of people that are over 85, and more people. In fact, it's the fastest growing part of our population is the old. So I took these statistics from the Alzheimer's Association Disease Facts and Figures for 2014. And more than 5 million Americans right now are living with Alzheimer's disease. 15.5 million caregivers are providing 17 billion, with a B, hours of unpaid care in the U.S. And if you think about that, almost 18 billion hours of unpaid care. Now, these cases are tough. So you may have a client that repeats themselves constantly or wanders all the time and never sits down, or they're up at night. Family caregivers can't handle that by themselves. Right now they're trying, but the statistics show that when somebody cares for somebody with dementia, a family member, that caregiver tends to get sicker much more so. Their medical costs go up. Their death rate is much higher. So it's very, very difficult for these people. So that's almost 18 billion hours of care that they're trying to provide that they need help with. The total national cost of caring for people with Alzheimer's and other dementias is projected to be $214 billion this year, again with a B. And caring for people with Alzheimer's and comorbid conditions is almost 3 times the cost of caring for people without the disease. And what that means is that if somebody has Alzheimer's and, say, diabetes, it's 3 times more expensive to care for that person with diabetes and Alzheimer's than it is to care for somebody that just has diabetes. And if you think about what we're doing right now, what Obamacare is all about and what our health care is about, it's about reducing rehospitalizations. It's about reducing medical costs. So if you think that these people that we're caring for it's 3 times more expensive to care for them. Well, if we have a plan that can manage them, think of how important we're going to be in this community. We're going to be a major contributor. Alzheimer's is an epidemic that's happening right now, and it's going to cost our country. They're saying it could bankrupt our country. So if you really think about what we can contribute to this, it's amazing the possibilities that are out there.
And so here's more about that market.
Right. So the market is absolutely huge and growing. There's unfortunately no end in sight. I wish there was, and I wish I could switch my specialty and I would still specialize, but I'd find another health disease to go with. But there's not. Alzheimer's, unfortunately, looks like it's going to be with us for quite a while, or dementia, I should say. And there's very few dedicated programs. You know, when you look at the diseases that are the most deadly, breast cancer, prostate cancer, heart disease, stroke, and HIV, in the last 10 years, they've all decreased. Alzheimer's is the only disease in the top 10 killers that is increased, and it's increased by 68%. So you add it all up that it's a huge market with no end in sight and very few truly dedicated programs for home care. Well, that's unlimited potential. So to me, that's a fantastic market. And, you know, the next slide I can show you what it's doing for us.
Yeah, your quality cases.
Yep. So right now, our agency, 65% of our current caseload is made up of dementia cases. Now, that's pretty high, but even if you're not trying, I would say as many as 40% of your cases could be dementia cases. So you're getting them one way or the other, probably not as high a rate as we are since we sort of advertise ourselves as the dementia experts. We're getting more. The average caseload with our dementia cases is 52 hours a week, which is huge. You know, these are cases that are very demanding. These are cases, like I was saying, it's got 17 billion, almost 18 billion hours of unpaid care. There's a lot of care. It's not like caring for somebody that has another disease. It requires a lot of hours, which is wonderful for us as far as a billing standpoint. And the average length is over 10 months for a case. So they last a long time. They're long hours. And, you know, an example, that one case I was telling you about with the husband and wife. Well, with the live-in and the 3 shifts around the clock for the wife, we're billing over $5,000 a week. That's $268,000 for one case. So It's a lot of work. We go out there a lot more frequently than we do our other cases, but you know, it's the equivalent of having, I don't know, close to 10 cases. You know, it's imagine if you could get 4 of these types of cases, you're doing $1 million in billing. So let's get the next slide.
Wow,
you know,
how to grow by $500,000. Awesome.
If you want to grow your agency by $500,000, and you use my math here, it really doesn't take a whole lot of cases. So if the average case is 50 hours a week, and you just got 10 cases, that's 500 hours per week. With an average cost, we're billing at $22 an hour. That's $11,000 per week in billing, or over $500,000, close to $600,000 with 10 cases. So again, one more slide. You can do the math. If there's 5 million clients or people out there with dementia, and we're just looking for 10 cases, your goal is $572,000. So do you think you can capture 10 people out of the 5 million people out there with dementia? Doesn't seem too hard, does it?
No. Somebody better hop on this here in St. Louis in case some of my aging family members need help. Oh, my goodness. No, it doesn't seem hard at all, but I know there's a lot more to it than that. But go ahead. So keep going. This is great.
So, you know, there's some other advantages to having a program in place. You know, like I said, even if you don't advertise for dementia specifically, you're going to get cases that come in just because there's so many people that have it. So your caregivers are under stress. If you have a good program, you're giving them the tools they need to succeed. You're giving them the confidence they need, and you're showing them that you value them as employees by educating them. And I know in my market, recruiting is one of the most difficult things. You know, it's very hard for us to get enough good caregivers. So when we get them, we want to keep them. And by training them properly, we're going to keep them. But we're also going to lower the stress of our office staff. You know, our coordinators, you know, when you get some of these really difficult cases, they pull their hair out. Every other day, the caregivers are calling out. The client wants a new replacement that comes in. The on-call people, it might be Saturday night, and that phone's ringing nonstop. So if you have properly trained staff and you have the right activities and the right program in place, it's lowering the stress on everybody involved here.
Well, and that must decrease the turnover from the turnover rate of your staff. And I know that CNAs and HHAs are tend to be a bit transient, and a happy employee is one that's going to stay. So.
Well, if you can give them long hours, it really helps. And if you can charge, you can possibly even charge a premium. So if you can give them the right hours, 8 hours a day for a long day, you're going to keep those people. They're not going to be leaving because that's really what they're looking for.
Sure. So what's the next step on, so if they want to start a program, let me just preface this also. By the way, guys, Gary has covered a lot of information already, and there's a few more slides to go. So if you have questions, what I want you to do is go to your little control panel. There's a place where you can type in questions. Please start typing in your questions for Gary because he will answer them at the end of the program. So again, at the end, when we're done talking about all this, he's going to answer all your questions. And they're first come, first served. So go ahead and get your questions typed in, and I'll open those up, and we'll go through them and answer them all. So if someone wants to start a program, what do they need to consider?
Okay. Well, first of all, there's a 12 in there that I guess I threw in that doesn't belong there, so everybody can just ignore that.
All right.
I don't want them to think, what's that got to do with this? So first of all, the agency owners need to be fully committed. They need to buy into this program because it's going to take a lot of support from them to make this work. They're also going to need to understand that they're going to need to train their staff, and that includes their care managers. And I consider a care manager to be the critical component here. And in our next webinar, I think the second series, we're going to really get into detail about how we train these people and what's involved with each of the things involved with the program.
Okay.
So the care managers are really, to me, critical parts of this. The people doing the phone intakes need to know how to sell over the telephone. And the people going into the homes need to know how to sell when they go into the home to do what we call a sofa visit. So if you're going in and there's 2 or 3 other agencies and the family has called, they've been giving this list by the hospital and they just made a couple of calls and now they're interviewing in their home, I'll tell you that when I walk in with my computer and my videos and my books and all the stuff that I have to present, we've never lost a case except when the family wanted to pay $15 an hour, and we don't go down in price like that. And if that's what they're looking for, we're not the right agency for them. But otherwise, we never lose one of these cases. It's just wonderful. So the the agency needs to make sure that they know how to sell in the home, and the coordinators need to know how to coordinate properly. Like I said, they're going to get these cases one way or the other, so you just need to know how to do all of this stuff.
So what does it look like? What does your program look like?
Well, you need to be, first of all, you need to know how to sell the program, so you're going to need the right tools. We have brochures that we use. We have a banner stand that we have for health fairs, books and manuals, and everything's got our logo on the back of it, obviously, and our phone number, the training manual that we use. We have a website where we get referrals from, and then we get PR from our Music from Memory program, which I'm going to go over in a little bit. In fact, if you go to the next slide, it'll show a little bit of the PR that we've gotten there.
Oh, yeah.
So,
newspaper articles.
This is a PR magnet, and you'll understand when I explain it to you at the very end how that works. This program is so easy to get PR, and PR, the whole program in general, the whole Alzheimer's program is a wonderful way to get PR, but our Music from Memory program is like nothing else, and it really generates a lot of free press. So first of all, you have to start out with your marketing, and then you have to be able to train your caregivers. So with our caregivers, we use a couple of different methods for training them. We use live video conferencing. So sort of like Skype, but we use a different program. And this way our caregivers can watch it from their phone. Even our living caregivers, they can go into the room if it's at night and they can watch it and do the training there. They can come to our office where we have a big screen TV. If they're at home and they have a PC or a laptop or a tablet, they can participate. So it's not just a video, but they're actually participating with a live trainer. So that's one of the ways, and probably the more popular way. But we also have a video series that we have, and they're broken down into short 10-minute videos. And the nice thing about the video series is that they have quizzes built into them, so that if somebody is going to watch this, they know they're going to be tested, and they tend to pay attention a little bit more. But the results from the quiz also get emailed to us and to the agencies so that they can use that for continuing education. We expect our caregivers to do 12 hours a year of continuing ed, and we put this towards that. And then we have a training manual that we use not only for training the caregivers, but also educating the family members, which is really, really a critical component to making this program work properly.
Wow.
Yeah.
And the training, I mean, the training is really huge. That is what you mentioned earlier, is you can't be an expert in this overnight. So you got to commit to this, not only yourself as the owner, but the staff as well.
Correct. So the training is very important. And then there's the actual program. Now, we use it. Ours is software-based. It's, again, taken us years to put together. It doesn't necessarily have to be that way, but we found that it sort of just walks you through, and it just makes it a much more successful program. But what we like to do to make it a full program is first have the type of dementia. Now, that's usually determined by the doctor. It may be Alzheimer's or Lewy body or vascular. If we can know what type of dementia, it's not critical that we have that, but it is helpful so that we can sort of predict what kind of behaviors we can expect. So different dementias behave differently. Then we want to determine the level of dementia. Now, there's things that the Alzheimer's Association uses, such as the FAST scale. We have our own method. So if somebody's a lower functioning person, they would be at one level. If it's a higher functioning person, they would be at a different level. And then with our program, that helps us determine what activities they're going to do based on what their level of dementia is. And again, I'm going to go into more of this in webinar number 2. We then create a daily schedule. And this is really the heart and soul of our program, because ours is an activities-based program. And we feel that people need to be on a schedule with the right activities. In fact, if you go to the next screen real quickly, and then we'll go back to this one.
Can you see
Johns Hopkins did a study, and I think University of Michigan's done a study recently. But what it shows is that an activities-based program that utilizes a schedule is actually more effective than the pharmaceuticals that are out there. And that was really great validation for what we're doing, because we know that it works, but now we've got proof that if you do follow this type of outcome, this type of program, you're going to have great outcomes. So now you can go back to the other screen, the previous screen. Another part of a successful program is that you have to do what we call the QOL, or quality of life. And what that means is that you need to be able to determine if what you're doing is working. And a problem with dementia is that as the disease progresses, the people become less and less capable of expressing how they're feeling. They can't tell you, I don't like this, or please don't do that. Instead, if the water is too cold, they don't want to take a shower. But you're going to think they're just resisting a shower because they can't tell you why. If the room is too busy or too noisy, they may wander. And again, you're going to blame it on the dementia, but we need to know these things. So we have an observational tool that we use that helps us check to see how things are working out that we've done and if we need to make any changes. And no matter how good we think we are, we're still going to have problems. They may have a urinary tract infection. They could be impacted. It could be anything. So we like to try and come to the root of the problem. Instead of blaming dementia, we want to figure out what that root cause is. So we have a part of our program called our Problems and Solutions that helps us determine that. So that's the most of the program. And then the 2 more slides, I think you'll see the one other part is that you have to have activities. And again, we're an activities-based program. We use books. We have our own custom books. You don't necessarily need that, but we found it to be very, very helpful. And our books are determined on the person's level of dementia, will determine what books they get. We have puzzles and our music from memory. So activities are just very, very important when it comes to creating a day for somebody with dementia.
And this is more of music from memory. Another slide for music. And how do they get the iPods and things like that?
Well, you know, I said that I was going to tell people how they can actually have referral sources asking them to come back. And I think that that's a very different approach, because typically as salespeople, we will go out and we'll tell them about our program. And if you're a good salesperson, you're going to ask for the sale. And you're going to say, do you have any cases for me? I can do this. Can you give me that? We've taken a different approach with our Music for Memory program. And what our Music for Memory program is that we provide an iPod and a speaker filled with meaningful music to anybody in our area with dementia, not only our clients. And the reason that we've chosen music is that with dementia, it's really unique that when they get to the point in the disease where they can't speak anymore and they don't remember who their children are and they don't know who their spouse is and they've lost all of these abilities, you put on music that is a song that they know, that means something to them, they start to sing, and the words are there, and they smile, and they dance. And for whatever reason, music seems to be in a part of the brain that is one of the last places hit by the disease. So we've taken that, and we figured, you know, we can bring some happiness and some joy to these people. And so we started this program. It's a nonprofit that we've set up, and we get iPods, and we give them away for free. So when we're going into these social workers and these hospitals and these rehab centers now, instead of saying, what do you have for me? Can you give me this? Instead, I'm doing just the opposite, saying, what can I give to you? I have these iPods here. Do you have any clients that could benefit from this? So now they're calling me and saying, hey, do you have any iPods? I have a client here that we want to discharge. He's got dementia, and I think he could really benefit from this. Not only are they introducing us to this client with dementia, but it's such a great relationship builder between us and the referral source. And it's such a great way to give back to the community that now we've got them calling us, asking, and we're giving instead of us always asking. So it's just a nice way to turn things around.
Wow, that is so nice. Oh my gosh. And so these are the little iPod minis, I guess, or?
Yep. Yep.
They are. That is so neat. Oh my goodness. What a great marketing tool too. I mean, I'm sure that you don't just give them the iPod and walk away. I'm sure there's a sticker or some brochures or some information in a bag that goes with the whole thing. And
absolutely. But I mean, you can imagine with a program like this how easy it is to get the PR, because it's such a feel-good type of thing, and it's the type of thing that the press loves. So we come out of this looking very good, and we are honestly doing a very good thing for the community. So I guess we should look good. But it also is a great marketing tool.
Okay, well, I'll tell you what. We're going to do questions and answers, and I have a few for you already, but we're also going to take some from the audience. So if you have a question for Gary, now is the time. I said this earlier, but you need to make sure you get it typed in, because there's you know, we had 300 people register almost for this, so we have lots and lots of folks on the line. So we can't open up the phone lines, but we will. You type in your question, we'll take your question. So I'll ask you a couple of quickies, and then we'll go and answer everybody else's. So one of the ones, you kind of already touched on this, but I'll ask it again. I have a hard time getting in to see referral sources. You claim that this opens doors. How does it do that?
Well, you know, not only with the Music for Memory program, but one of the other things that I think you're able to do when you have a program like this is to educate. And these referral sources don't want to be sold. They don't want somebody coming in and selling them. But if you have something that's unique, and this truly is, and if you have a program that is cutting edge and it's going to educate them, it's going to help them do their job better, they'll listen. I know of one of the agencies we work with right now just had a lunch and learn where they invited a bunch of people to their office, and they told them we have this exciting cutting-edge program, and it went over great, and they had a whole room full of referral sources that came to their office. So you can do CEU programs with this, but if you can educate them, they're willing to come in or let you come in and listen to them. They'll listen to you. So it's really a great way as long as you're educating and not necessarily always selling.
Okay, and then I want to give out your contact information. So we're going to go through and answer these questions, but I just want to let you all know that when this is over, if you want to contact Gary, you want to contact him at gary@alzbetter.com, ALZBETTER.com, or call him directly at 856-281-1200. 856-281-1200, and then definitely go to visit the website at alzbetter.com. So we're going to go down the list here, and I have a few other questions that you gave me, and we'll go through those too if we have time, just to get some of these folks' questions answered. And one of these I'm going to answer for you. Well, okay. Will a printable version of this material be available? And just for all of you, you know, I always give out this advice. And this video will be available to anyone who wants to see a replay. We will actually send out the link to the video. Gary will have it, and so there'll be plenty of opportunity for you to see this webinar again. And there are 2 more coming up that explain the other details of the program, but this is his proprietary information, so we're not going to give out the slides. The next question, though, is from Jane, and she said, did the slide with the pinstripe graph show growth equal to $1 million in 1 year, or was that the total revenue for the year? I think that showed your growth for that year, correct?
Well, actually, that was a number of years.
A number of
and the last year, it really spiked. So 2 years ago, we actually had a very good year, and then last year, it just really went nuts, and you know, we just grew exponentially. So that was showing the growth over a number of years.
Great. Okay. And then let's see. The next question is, do the caregivers each need to be CDPs? You'd have to, I don't know what a CDP is. No. Okay.
A certified dementia practitioner.
Right.
So we have our own certification program here that we do. So they do not. And it really depends on the case, but we suggest that all of the agencies make sure that their caregivers go through the program. We have 6 hours worth of training for the caregivers, and that's part of our certification program. But we do recommend that they have at minimum that 6 hours worth of training to provide the care.
Okay. And the next question is from Jane. Do you provide any house calls by doctors? Are you involved in any ACOs?
No, we're not. We really don't work with, I mean, we get referrals from physicians, but we're not involved in that.
Okay. Do you market this on the internet? Are you using, if so, are you using pay-per-click?
We're not using pay-per-click, and we really have just, in fact, this is our first webinar with this. We've been developing this for 4 years, and we started out with just a couple of beta agencies to make sure that we got things right. And we've really just finished up with those beta agencies, and we went to one of our first trade shows last week. And so this is really brand new that we're breaking out now. So no, we really haven't done a whole lot of marketing with this yet.
So really, I know you have your website, and we've all known each other for a very long time, and we're, kind of helping by doing a little webinar series because we think this is extremely valuable. And so that'll be out there. But other than that, this has been really referral business. This has been person-to-person referral business.
Oh, well, locally, yeah, we just sell it the way we sell our home care companies. We haven't done any pay-per-click or anything in that way. No, and it works. It just sells so easily.
Yeah, that's awesome. And then speaking of trade shows, you're going to be in New York with us July 10th and 11th at the boot camp, right?
Correct. Well, actually, I'm very excited about that. I went and met with the hurricane, and and he seems like just a great guy, really knowledgeable when it comes to selling, and yeah, a lot of energy. And I'm really looking forward to it. I think that's going to be a lot of fun and then a lot of learning.
Oh yeah, absolutely. Now, this is a little bit of a different question. All it says is meaningful activities for residents with dementia. I guess, and I don't know exactly what he meant by that because that's the whole statement, or the whole question. That's not really a question. But it seems to me that this program could also be implemented in a facility if they really wanted to.
It is, and we're trying to figure out how to adapt that to facilities. The biggest challenge is that in home care, what's great is that we are one-on-one with people. And when it comes to dementia, when we talk about our meaningful activities, people with dementia are unable to change. So when they are who they are, they're not going to be any different. And if they've been reading the newspaper with breakfast every morning for the last 50 years, and they watch Channel 10 News every night at 6 o'clock, and whatever their schedule or their program is, that's who they are, and that's who they need to remain. So when we say meaningful activities, we're looking for activities that are meaningful to them, that are part of their life. If they like building birds. Correct.
Yeah, not meaningful to the caregiver, meaningful to the...
Right, and it's not that, we all, we have breakfast every morning at 8 and we shower at 9 and we have this activity. Well, if that's not if they showered at night, you don't want to have them showering during the morning. So part of the thing that we're trying to figure out is how can we make this work in a facility where it's not quite as individualized as it is for home care. And that's one of the great benefits of home care. And that's where, everybody says, oh, when somebody has dementia, you have to put them in a facility. And I disagree and say, if you can give them the right care at home, it's much better because it's a place that they're accustomed to and that they can do the activities that they're used to doing. And that's so important to somebody with dementia.
I totally agree. The next question is from Alistair. Do you train all of your caregivers on your dementia program or just some of them? Also, how much training is necessary for caregivers to support this program? How many hours?
Okay. Well, again, it's a minimum of 6 hours. We actually have a couple different levels of training. And we have not trained we do a basic orientation for everybody. What I've learned is that some caregivers are better than others when it comes to dementia. And some people, they just, you have to understand the disease. And you have to understand that it is a disease. And if somebody's not capable of really getting that, and they think, oh, this person is mean, and she's doing this, and whatever it is, and doesn't realize, well, she has a disease and she can't help it, if they don't have the right mindset and they're not really capable of learning, we probably aren't going to put them through our program. And we may still use them. They may be great for some of our general cases, but not for our dementia cases.
Right. And that's absolutely. I mean, I think if you're going to commit to this, you commit to it with everybody that's going to be on the list to provide dementia care.
Correct.
It's got to be the way it is. Okay. Right. This is more of a, well, I'll let you answer this. With these cases averaging 52 hours, how do you plan on providing this care with the new Department of Labor law pertaining to the companion exemption?
Well, first of all, it's not all live-in cases that we're doing. Many of them are hourly cases. And in New Jersey, it doesn't affect us quite as bad because we are paying overtime anyhow, or anything over 40 hours we have to. So we've been sort of living with that forever. So the rest of the country, I know it's affecting them differently. But, it's not ideal. I would much rather have one caregiver be able to do 52 hours. And it's much better for the family, and it's better for the caregiver. But in this case, we would do 2 or 3 different caregivers so that we're not paying overtime for that. And again, we've been doing that here for quite a long time.
Yeah, that's a great answer. How far in this degenerative disease can the program go, and at what point is there a necessity to hand over to a more intensive level of care, like assisted living or nursing home care?
Well, again, it really depends. We can take people all the way into the home. What's beautiful is at hospice, we can team up with hospice, and we can provide our care, and then hospice come in and bring in the palliative care or bring in their hospice care. And unless somebody is uncontrollable, and there are cases that are not appropriate for home, and those cases need to go into a facility. But just because somebody's advancing in the disease doesn't necessarily mean they can't stay in their home. And most people want to be in their home, and with the right care, there's no reason that they can't. Now, it depends if the family has the funds. Again, not every case becomes 24 hours. Sometimes family members can do part, and we can do part. Sometimes we're doing a live-in. Sometimes we're doing around-the-clock care. So it really depends, but I don't see any reason that people can't stay at home throughout the entire process.
Right. I totally agree. If it's right for them, they should be able to, and if they can get the right support. It's all about the support.
Correct.
Let's see. Oh, just so you know, someone sent a very nice message. The whole program is music for my ears. I think that, but that's,
well, that's
very
great
nice
to hear.
To say. There are some technical questions here that I'll let you answer individually, like how do you preload music on iPods? I think you have all that worked out. You've been doing music from memory for a long, long time. I think I remember you doing this many years ago. So
right.
That kind of, you've got that down to the science, and I'll let you answer those. You'll get all these questions. Let's see. Okay, let's see. What states do you service? Well, I think that kind of depends. This is available in any state if you want to sign up for the training, right? You want to sign up
Correct.
for the program, your home care.
Correct.
Okay. How do you get your caregivers to complete their 12 hours of required training each year? Aha.
It's not easy.
You got to keep on them.
We do. We keep track of it. We do pay our caregivers for their continuing education training, so I think that's important. And, you know, you have to sometimes chase them and stay on top of them, but we also try and make it convenient. So if we're doing it in the office, clearly we're going to try and make it fun and, you know, bring in food and make it entertaining. But we also, again, have these videos online that they can watch on their phone and they can watch at home. So we've tried to make it as convenient as possible for them to do it, and we tried to make them interesting. But with that being said, you still have to stay on top of them. It's never, that's always been a big challenge.
Right, absolutely. Let's see, I'm trying to see. Oh, this is a good one. This is about exclusivity. We knew this was going to come up. So, do you offer exclusivity? If one home care agency in an area buys this program, how many more in the area are allowed to buy the program?
Right, and we offer this on a semi-exclusive basis. So depending on the size of the area, if it's a big city, there may be 4 or 5 agencies, but typically there's about 3. We limit it to 3 agencies per territory. So it's really first come, first serve. Whoever, once it's filled up, we're done. We won't sell to that unless somebody decides not to stay with us.
Sure. I mean, and remember, folks, this is a commitment. This is a commitment of an owner's commitment and a staff commitment, and you have to carry on with it to make it work. And in a place like, say, New York City, I mean, you may never bump into each other if there are 5 of you serving different parts of the city. Or, you know, Chicago. Oh my goodness. You know, there's 6 million people in Chicago alone. So there's, you know, having 3 or 5 agencies that offer it can only be more helpful than it is.
Well, and I think with 5 million people having dementia, we don't want to, if we can help it, limit it to just one agency, because that may not provide, we feel that this program is necessary for people to stay home. We feel that it's just very, very important. And we don't feel it's really fair to the dementia community if we only have one agency and they can't get it anywhere else. And if that agency can't service all of those people, I think there's really enough people for several agencies to be supported very easily.
Oh, sure, absolutely. Let's see. Do caregivers that complete the training get a higher hourly rate?
They can. We are not doing that at this point, but it's something we've been playing with. And in fact, we met with one of the VNA in our area who seems to have all the work they need, so they weren't looking at this from a marketing perspective, but they wanted to charge a premium for this, which is certainly doable. And we upsell it a little bit, not to what they were looking to do, because they just wanted to pay their caregivers more. And you know, that is something that we were looking at doing as well.
Wow. Excellent program, enlightening, great food for thought. Thank you so much. That was from, let's see, well, I just read it, from Marianne. Oh, well, and there's a question here, what is the cost of your program? And I think I'll let you answer that, but I think that's really in a case-by-case basis, isn't it?
Yeah, it depends on the size of your territory. So if you want to know about the program, I would say shoot me an email or give me a call. I can go through the program in its entirety with a webinar and show you really the details of how it works. But it is based on the size of the territory. It's not a franchise, but it is based on the size of the territory.
And how long does it take to start a program?
Well,
so if somebody signed up today,
right, if somebody signed up today, it generally takes about 3 to 4 weeks to get started. And the reason is that we customize all of the books with your information and the marketing material. It's really a turnkey package. So we're going to create the brochures, take our brochures and put your information on it. We're going to take the books and put your information. So it really becomes your program. So it takes time to get it to the graphic designer and then get it back from the printer. So it's about 3 to 4 weeks. And then after that, that's when we start, and it's 14 hours of training. It generally takes about 2 weeks. We do it about 2 hours a day for 3 or 4 days a week to get the training in, and that seems to be most convenient for the agency owners.
Tell me, there's a question here. This sounds difficult. How hard is it to implement? I mean, you kind of just talked about that a little bit, but talk about how you got to your $1 million increase in revenue.
You know, I'm not going to sit here and tell you that it's really, really easy, because it takes work. And if it was really, really easy, everybody would be doing it, and there would really be no advantage to doing something like this. But the way that I look at it is that most of these agencies, if they're anything like I was, and I've been at a very small agency and worked long, hard days, they're working very, very hard, but they're not necessarily working very, very smart. And to me, working smart means I'd rather spend 20 hours a week focusing on this program, implementing this program, learning how to do this properly, rather than go from hospital to hospital hoping I can get past that gatekeeper, hoping I'm not bothering the social worker, very unproductive visits. Our agency, we grew by almost $1 million, and we had a part-time salesperson, and we spent about $10,000 on advertising. So to me, it's really about working smart, not necessarily working hard. So you're already working hard, but you're just changing your energy as to where you're putting that.
And everybody should be working a little smarter, and I'm sure we would all agree about that. So, all right, so I have the last slide on the screen. I think we've gone through most of the questions. We didn't get to every single one of them, but it is almost the top of the hour. So we're going to call it a day. But for folks to get a hold of you, and folks, from my perspective as a registered nurse, having known Gary and his business partner, we've known these folks for a very long time. They've been clients of ours. They're very upstanding, good people, and I just give that endorsement. And I know that this has taken a very long time for Gary to put together, and he has done the research, and he has done a great job. And he's, you and George, and you and I and George have talked about this just a couple times over the years, and I'm so glad and so happy to see this come to fruition and be a live thing that you can present to folks. This is amazing.
Thanks.
So,
yeah, it's really exciting.
Yeah, oh, absolutely. So if you want to just talk to Gary, if you have some more questions for him, email him at gary@alzbetter.com or call the office at 856-281-1200, or visit the website at alzbetter.com. There's a lot of good information there. You can get, what you need, and certainly you can contact Gary from there as well.
And the one thing, Val, if you can go to the next slide real quick.
Oh, sure, absolutely.
If they go to the website, there's a banner on top of the website, and the website is really for the general public, but if they click on that banner, that takes them to where the agency should be.
That's right. Home care and hospice agencies interested in offering AlzBetter. Yep, go straight there, and that'll be the best place to go. But I love the website. It looks really good. It's got a lot of good resources. So with that, we're going to call it a day. So thank you, everybody, for attending, and we will send out this playback in an email or two, so you all will have it. You can send it out to anyone you want. Please share. And Gary, thank you. We'll see you next time. We'll send out a reminder and let everybody know when the next webinar is. It's in a couple weeks. And we'll keep going down this path and let you know more about the AlzBetter program. So thanks, everybody, and thanks, Gary.
Thanks, Valerie, and thanks, everybody, for attending.
Okay, thanks. Bye-bye, everybody.
Bye-bye.